Hey everyone, welcome back to my channel. This is Holly for those of you who have not watched any of my previous videos, and I am walking through my right hip arthroscopy surgery. And I must say, to start off, I am fuming right now because I just filmed this video on my Mac computer and it was like a 14-minute video and it somehow didn't save at all. So I'm literally starting from scratch. I feel like my brain is just a jumble of words right now, but I'm gonna try to get through everything again and try to be as thorough as possible again because I cannot recover that video, so darn it. So I left off back in June with my right hip arthroscopy surgery. So what happened was, I had said that I was getting my left one looked at. Since that happened, they did look at the left one, the same kind of thing was going on, and I did have surgery on that one 3 weeks ago. So I'm 3 weeks post-op for my left hip surgery. That was on August 11th. The first one, the right one, was on May 13th of 2020. So I was just shy of 3 months. Now I'm like 3.5-ish months post-op on my right leg. So let's finish off talking about my right leg first. I would say right now, as far as range of motion goes and everything, it's still pretty stiff, doing specific movements. Before the surgery, I was able to do pretty much everything I wanted. I was just starting to kind of like run a little bit. I was approved to do that. You are approved, so to speak, at 3 months, and I was just shy of 3 months. But other than that, I was able to do the elliptical. I was able to bike. We could pretty much do whatever I wanted. We were playing, I went golfing, playing catch with a baseball, pretty much anything. You're good after 3 months. Am I happy I had the surgery? Yes and no. Yes, because my surgeon is amazing and she was so set on that I would have definitely had to have a hip replacement. No questions asked with that cam type impingement I talked about in earlier videos, and just bone on bone with that labrum tear. She's like, there's no way that you would have not had to have a hip replacement, most likely in my late 30s or 40s, which is crazy. I'm glad that they caught that. I'm not happy that I had the surgery because the number one reason for the surgery was to fix my back problems. I'm still having a lot of back pain. I haven't noticed a huge difference. I have an amazing physical therapist that I'm still working with. Best one I've ever had. We are still continuing to work on my back. A lot of dry needling into my lower glute on my right side, and then just chronic right back pain that still has not gone away. So that's really hard to swallow, honestly, but we'll just see what happens. It's never say never, and it's gonna take it can take up to 6 months for complete recovery from this surgery as far as the range of motion goes. So yeah, that's where we're at with the right leg. I was pretty much back to normal, and then as soon as I was about to be back to normal, we had the left side. So I'm gonna go ahead and talk about the left side now. After getting the MRI results, I really had to ask myself, do I wanna do this or do I not? Because I wasn't experiencing a lot of pain in the left leg. After how much damage was in the right leg, the surgeon she really wanted to do it. She's, said, if you were my daughter, I would have you do it. You're going to experience pain. It's not if, it's when, is what she said. She said that, we should have it done now, especially with COVID-19 going on. It's been honestly the perfect time to go through all this. I have a great job where I'm able to take off work for this kind of thing, for leave and stuff. And insurance purposes as well, it makes sense to just kind of knock it all out at one time while I'm in this stage of my life, and I had just gone through the right side. So we went ahead and scheduled it, and I had the left one done. While in surgery for my left leg, I kept everything the same. I did the spinal anesthesia again, that went well. During the surgery, they were actually able to manipulate my right leg and my right hip. Not totally sure what that means. I'm assuming like range of motion, flexibility, that kind of thing. Just to work on that. She said that I was able to get a couple more degrees of rotation, so that's awesome. I haven't really noticed it, really. I'm still working on the range of motion and flexibility for sure. And that's something that you can't start working on until you are at least 6 weeks post-op. At least that's what my doctor and surgeon, our doctor and physical therapist have said. So yeah, it has not been easy at all. It's a ton of time commitment. If you really want to get back to where you were pre-surgery, it's, you know, you got to put the time in, you got to put the effort in, and it's definitely not easy. So it's been a roller coaster, but I'm confident that I'm going to be back and better than ever when I'm ready. So more about the left hip. If I had one word to describe the left hip surgery versus the right hip surgery, actually two words. Completely different. Like literally night and day comparisons on the left to the right. So the left hip, it wasn't as bad. I'll start with that. The surgeon said instead of 5 anchors, which was on the right one, there's only 3 on the left, which is more standard, and she didn't have to take away as much bone on the left side, which wasn't surprising because it was not bothering me yet. So that made sense. Although she's still really glad that we did it. As far as movement goes, with my right leg, I just watched some of my old videos. I was not able to do a straight leg raise even at 3 weeks. And today I'm 3 weeks post-op. With my left leg, I was literally able to do a left leg raise the next day. Like 24 hours later, I could lift my leg just fine. I mean, it hurt, but like I could do it. The other side, I physically could not do it until I was, I think, 3.5 weeks post-op, which is wild. The right leg, or the left leg, I mean, obviously I kind of knew what to expect as I'd gone through it before, but I mean, sleeping was better, and I ditched the crutches literally as soon as I could. I mean, you can kind of see them back there hanging out by the vacuum. They said 2 weeks at 20% weight. As soon as those 2 weeks were over, I was like, see ya, crutches, done with you, no more. Am I up and like going for walks? Absolutely not. But I'm able to get around the house just fine. I can go to the grocery store. I can drive. I mean, I was literally driving like, I don't know, as soon as I was off pain meds, so a couple days. Obviously this was also my left leg, not my driving foot, but I mean, literally night and day difference. I wasn't able to walk on my right leg for, like 4 weeks. I was on the single crutch, that kind of thing. Again, I'm not able to like go for walks or anything, but it's much better. I have some questions that some people wanted me to answer. Just hold on, I'm looking on my computer here. Okay, sorry, this is the wrong thing here. Hold on. Awkward silence. Okay. Movement / range of motion overall. So yeah, the left leg's been better already as far as range of motion goes. Again, you can't really push that until 6 weeks. The right leg, again, it takes a lot of work, like sitting with your leg out and relaxing and pushing, and it's uncomfortable, but range of motion's getting there. It's proven, like my external rotation, I can do that right now on my left leg, but you can't do internal rotation. Just listen to your doctor, that kind of thing. The pre and post testing with the surgeon, I went in, I think, with like 5 degrees of motion on my right leg. I'm at like 15 degrees of motion or degrees of rotation now. So it's getting there. But again, this can be up to a 6-month recovery. So patience is key. Tips on physical therapy when both legs are weaker. I did not have to really do that. As I said, mine was 3 months out. I was already like doing everything on my right leg by that point. So when I started physical therapy on my left leg, my right leg wasn't weak. I would probably suggest that. I know some people have it done like within, I don't know, 5-6 weeks. That's would have been, I probably could have, if I did my left leg first, I could have done them closer together, but like that's a little crazy. I like needed some sanity in there of like regular everyday life. I think jumping one surgery to the next while your leg is still weak is like very, just a lot mentally and on your family and friends. And yeah, so I don't know if I would suggest that, but anyways, I did not go through that as far as legs being weaker. Pain medication, how often was I taking pain meds? For the first leg, again, you can watch my earlier videos, but I think it was like 3 days or something. I'm not one that likes to be on pain meds. They make me, I'm super susceptible of like getting dizzy and stuff and like nauseous. So I try to stay away from that. The oxy also makes me really itchy, like my skin itchy. So I try to stay away from that. Besides the drugs, I was on like that anti-bone regrowth. I think I mentioned it in the first video. I forget what it's called. It starts with like an F, I think. I don't know. Don't quote me on that. But yes, so I took those, like the anti-bone regrowth for like 4 days. I took oxy for probably like 3 days, or like probably 2 days with the first one. And I think that was it. As far as the second surgery goes, my second surgery, which is really random, actually hurt a lot more. The leg was a lot more swollen. The sutures didn't look as good. When I took my bandage off, it was literally like full of blood, like blood everywhere, like discharge pus. Sorry that I have to get that vision in your mind. But the right leg had nothing. Like the sutures looked great, no problem. I got the sutures out on my left side. Even then, like they just don't look as good. They've taken a lot longer to heal, just like the skin in general. But yeah, so this time I took oxy a little bit longer. I think like at least like the first 4 nights, even maybe 5. It was just a lot more sore, like the actual skin, and like it was just puffy. And the right leg wasn't very like puffy or anything. So that was definitely different. What else? This time I'm taking naproxen. It's like an over-the-counter Aleve for an entire month. So they said to take it twice a day for a month, but like I'm taking it like once a day when I think of it. So trying to do that. That's for like internal swelling. Just playing it by ear. And then this last question is asking if I'd take a higher dose of aspirin for both legs. So funny, again, my right leg, like I didn't have to take any aspirin. That was never a thing. Like those first couple days when you take the anti-bone growth stuff that I can't remember the name of, that has the same effects of like an aspirin as far as clotting goes. The left leg though, they had me take a baby aspirin. I'm supposed to be taking still 1 a day for a month of the baby aspirin too. Not taking that anymore, although maybe I should, but like I'm moving around a ton. I'm not gonna get a clot at this point, but honestly, just listen to your body. Like you will know what you need to do. Like if your foot's swollen, like wear the compression socks. Like I wore those socks. Like my mom and Michael, my boyfriend, can attest to that. I wore those stupid socks for like 5 days at night because like you're not moving. You wanna make sure you're not getting a clot. You wanna like elevate your leg, like try to get some motion into it. Like last time I got a bed sore because like I was literally sitting there way too much and putting pressure on that heel. This time I didn't do that. So just like being smart and listening to your body. If you're not moving around a lot, heck yeah, like take your aspirin, wear the socks, elevate your leg, do the icing, just listen to your body, listen to your doctor, listen to your physical therapist, and like you're gonna be just fine. So yeah, that's my experience. This leg has been 100% better. I'm not back to work quite yet. Just, you know, mental break as far as just like everything I'm going through. You know, I don't know what to expect. I didn't know what to expect for the first one. So just making sure everything is good and like ducks are in a row before I make that leap again. No pun intended about leaping, but I'm just gonna keep working on my back and everything and keep on moving forward. I plan on probably making a video when I am like probably 3 months-ish out for the left leg, which would be 6 months out for the right leg, and then maybe like a year update. Also, huge shout out again to my family and friends that have reached out and been there for me. This has been easily like the toughest summer of my entire life, obviously with everything going on in the world, as well as mentally just being, you know, cooped up, and physically, obviously, with just the pain and everything. But I've had such a great supportive team behind me. Again, like, listen to my prior videos, like, you will need someone to move in with you. If you have like a friend or a roommate or family member or significant other or whatever, if they work from home, like that would be amazing. Otherwise, like for the first, I'd say like 3 weeks, just to be safe, you will need someone. If you have a dog, you will need someone. So like keep that in mind. If someone can only be there with you for like a week, don't schedule the surgery. Like if you need to go back to work like within a week, don't schedule the surgery. Like wait until there's a time in your life where you are fortunate enough to have the help that you need or be able to take off the work that you may need. It's super important just so you're not stressed out. Like you need to focus on yourself, focus on your body, and just like getting better. That's the number one thing. Yes. So Michael, my mom, my parents in general, Michael's parents and other friends and family, thank you so much. It has been super nice to hear from those of you that have cared. So anyways, it's not going to be a while for my next video. If you do have literally any questions, like comment on my videos, subscribe. I don't post too much, so like you don't have to do that. But comment, ask questions, send me an email, and I am more than happy to answer literally anything that you have, hip related, physical therapy related, anything. So thank you for watching this super long video that I actually had to tape twice, and I hope I didn't miss anything. Anyways, have a good day.